Vertigo can be a crippling condition. Let's take a look at one woman's journey.
The first time that I ever had the episode with vertigo, I was actually at the hairdresser's with my head back in the sink, as I've done a million times, and I came out of the sink and all of a sudden the world started spinning and I was spinning in the opposite direction.
Vertigo is what we typically refer to as a spinning sensation. People most often complain of dizziness and imbalance with it, but generally when we use the term vertigo, especially in physical therapy, we're talking about a spinning feeling.
The particular one I have is the one I can speak to, and it's called benign proximal positional vertigo.
There's these calcium carbonate crystals in your vestibular system that are gravity dependent, and what they do is help tell your brain where your head is in space. They're usually in a dense like gel fluid, keeps them in place so they can give the right signals to your brain. However, sometimes they get dislodged from that gel fluid and they can start spinning in these semicircular canals that make up the vestibular system. When they're spinning in the semicircular canals or they get stuck in those canals, that's when they can cause the sensation of spinning and dizziness because they're giving the brain mixed up signals about where your head is actually in space.
I went for almost 2 weeks not knowing what this was, and I started by going to my family doctor to find out what I should do. And he did do some other tests. I had an MRI, and I also had blood work done to make sure it wasn't something much, much more serious. And in that process, I was also doing some online research and found out that there are therapies for what I thought after reading about what I had was vertigo.
Vertigo is treatable. No matter what canal the crystals are stuck in, we treat with repositioning techniques. One of the most common ones we use is the Eppley maneuver, which people may have heard of. And basically, we're just doing a series of head turns and body rolls to kind of guide those crystals back into their original position where they came from.
Before the treatment, I really was unable to do a whole lot of daily things. I was really scared because I thought I can't do anything I want to do. I couldn't be with my children. I couldn't go to my job. So the first time I went to see Kristen, the first thing she had to do was actually force me into a vertigo state.
Her case was pretty severe in the beginning. She did not like going through all the testing and the repositioning, but after about 3 sessions, she was clear of it. Treatment lasts 5 minutes or so, and then each patient is required to sit in a nice upright position for 20 minutes just to kind of let everything settle, because it's common for you to feel dizzy and a little unsteady after these things are done.
I feel fantastic that I have my life back. I mean, the vertigo is always going to be there, but the biggest thing is I'm not scared of it. I think that's the thing that Kristen taught me the most, is I know what it is. I know she can help me, or someone who is vestibular certified can help me. And so that's a huge blessing just there, that I don't have to worry that it's never going to be treatable and then I'm going to have to deal with it my whole life, but at least I know how to fix it.
To help people regain their life back and to improve, it's great. There's nothing more rewarding than that, and I find this treatment to be so quick and efficient and to help people so quickly. They're usually really grateful to get their life back.